Hello everyone, my name is Sophia Eghorieta. I'm an intern pharmacist at the pharmacy department of University of Ilorin Teaching Hospital, and I'm here to talk about the World Tuberculosis Day. The World Tuberculosis Day holds March 24th every year. It's a day set aside to create awareness about tuberculosis. Now, this day does not only commemorate the date in 1882 where Dr. Robert announced the mycobacterium tuberculosis, but it's a day set aside to create awareness about the devastating health, social and economic consequences of TB, and also to step up efforts to end TB globally. Statistics has it that tuberculosis is the 9th leading cause of death worldwide, and over 25% of this death occurs at the African region, with Nigeria being the second high TB burden country in Africa and the 7th among the 30 TB burden countries in the world. And Nigeria records 460 cases annually. Now, what is tuberculosis? Tuberculosis is a contagious infectious disease that affects the lungs. It can also spread to other parts of the body, such as the spine, the brain, the kidney, and the joint. It is caused by a type of bacteria known as the Mycobacterium tuberculosis. Now, anyone can be affected, meaning it's not age-specific. It can affect children, it can affect adults, it can affect pregnant women and adolescents. Now, what are the signs and symptoms that comes along with TB? One of them includes coughing up blood, cough that lasts longer than 3 weeks, chest pain, night sweat, loss of appetite, and severe weight loss. Now, there are two types of tuberculosis. We have the latent TB and the active TB. The latent TB, as the name implies, this means that the patient has the tuberculosis bacteria present in the body, but the immune system is strong enough to contain it, therefore keeping it from spreading. So no signs and symptoms experienced by the individual, but when left untreated, this latent TB can advance to active TB, especially when the individual is down with other life-threatening diseases like HIV/AIDS. And also latent TB cannot spread from one person to another. The second type of TB, being the active TB, is the opposite of the latent TB. Now, it is contagious, it has signs and symptoms that be experienced, and most of the cases of active TB originate from the latent TB. Now, who is at risk of having tuberculosis? What are the risk factors of tuberculosis? One of them is coming in contact with family members or friends who have been diagnosed to have active TB. 2, traveling to areas that record high TB cases, or living in areas that record high TB cases. 3, people with weak immune system, or that have diseases like HIV. HIV is top on the list because the HIV virus affects the immune system, and once the immune system is weak, it gives room for opportunistic infections, and one of the opportunistic infections is tuberculosis. And people with diabetes, people with cancer, head and neck cancer, and other type of cancer, people who are taking some certain medications like medications for organ transplants, medications for rheumatoid arthritis and psoriasis. Now, smokers as well, they are also at risk of having tuberculosis. So it is advisable that smokers abstain from smoking. Moving on to the diagnosis and treatments, tuberculosis can be diagnosed in different ways: skin test, blood test, chest x-ray or examination to check for any abnormalities, and the AFB, that's the acid fast bacillus test to check for the bacteria in your sputum. And for the treatment, a standard care of treatment for tuberculosis involves 4 drug therapy. That means taking of 4 drugs at a time, because making use of one drug can create rise to drug-resistant TB. So the treatment plan comes in phases. We have the initial phase and the continual phase. Now, the initial phase goes on for a period of 2 months, that's 8 weeks, with all 4 medications being used. Now, at this initial phase, most of the tubercle bacilli can be killed, but there are some that are persistent. So that's why it's important to move on to the continual phase. Now, the continual phase lasts for a period of 4 months or 7 months, as the case may be. 4 months for majority of patients and 7 months for patients whose test result comes out positive after the end of the initial phase. Those people are advised to continue their treatment for several months with lesser drugs, of course. Now, it's important to note that when making use of these medications, that there are some side effects that can come up. But when the side effects come up, please do not stop your medications without seeking the advice of your doctor or your pharmacist. Side effects like colored urine, yellowing of the skin, eyes, loss of appetite, to mention just a few. So when this side effect comes up, please do not stop your medications halfway, because stopping your medications will only give rise to more problems. And one of the problems is drug-resistant TB, which is more difficult to treat and more expensive and take a longer period of time to treat. Now, it's also important to note that when undergoing treatment for tuberculosis, abstain from alcohol, because taking alcohol alongside your drugs will only give room to more problems. And one of the problems is increased liver problems, liver diseases. And avoid taking unnecessary drugs that are not prescribed alongside your medication to avoid drug-drug interaction. Some certain food like cheese, red wine, to avoid drug-food interaction. Now, moving on to preventive methods of tuberculosis, though it is fatal, it can be preventable and also treatable. Now, one of the ways tuberculosis can be prevented is when going to areas that you know are TB rated, try to avoid crowded places and try to get tested. Do your routine checkups as you should. Now, limit the contact and hours spent with family members or friends who have been diagnosed with active TB in order not to contact it from them. Now, cover your nose, your mouth when you cough, when you sneeze, when you laugh, when you talk, because the bacteria spread through the air in droplets when persons with active TB perform these activities. Make use of your surgical masks, especially during the initial phase of treatment, in order to prevent TB. Now, in conclusion, global incidence of TB is declining at about 2%, but this needs to increase to 4-5% annual decline, because ending TB by 2030 is one of the sustainable development goals. And in order for our country to make substantial progress, we all have to work together, with you adhering to your medications as you should, speaking to your doctor, pharmacist as you should, going for your routine checkup once or twice a year so that latent TB can be spotted on time. Live a healthy lifestyle. Stop smoking if you're a smoker, alcohol. Stop this, live a healthy lifestyle in order to prevent the rise of tuberculosis. We have to end TB, and the time to end TB is now because the clock is ticking. Thanks for listening to this video.